Hey everyone, Enrique here, your massage therapist and esthetician based in New York City and Los Angeles. Today I'm in New York. We're going to sit down and talk to Dr. Craig Keys, who's an internal medicine doctor who specializes in men's health. We're going to talk about a sensitive topic which affects millions of men, and that is erectile dysfunction. We're going to talk about erectile dysfunction as well as treatment options that he has out there for this specific condition. But before we meet with Dr. Craig Keys, make sure you subscribe. Set the bell to alert you when I post a new video. And thanks again for watching. Watch the entire video. Hey everyone, Enrique here once again. We're here today with Dr. Craig Keys, a very well-known doctor in New York City. And we're going to talk about erectile dysfunction, which I think is kind of like a taboo kind of thing, don't you think? Like a lot of people have that condition, but they don't really talk about it. So since I've been affected by that, as you already know, I figured I wanted to put the spotlight on this and just talk about it. You can explain to us why it happens, some of the treatments that you offer. I don't know, anything that can help our viewers learn how to approach this, especially with men. I feel like a lot of times men don't want to seek medical care in general, but specifically for this type of problem.
Well, you're absolutely right. And in fact, I think it's a matter of being taboo in a couple of respects. First, it's taboo among the men who suffer those kinds of experiences and symptoms. They don't want to talk about it. It's humiliating. It is, they're made to feel less of a man because it's thought to be such a large part of manhood, and particularly among men who have sex with men. And those men in particular face a tremendous challenge securing their identity if they're not having sex. I had one patient say to me, well, why did I fight for gay rights if I'm not really gay anymore other than in my head?
Yeah.
And it was really, it was a very powerful remark. I hadn't even considered that. But it's also taboo, and you may have experienced this, in terms of the medical community itself and its comfort with talking about this. When I was in training, it was very difficult to get questions answered about sexual
from
function.
other medical doctors?
Right.
Oh, really?
And I know many of my patients have remarked that they can't believe I'm answering some of these questions, that they were told they don't need to know these answers, and that struck me as odd. I never thought having information was a bad thing, and so we make that a really.
And what's your take on that? On doctors not wanting to?
I think it's just uncomfortable for some people to talk about sex. It's uncomfortable for a lot of people to talk about sex, and I agree with you. It's even more challenging for men. I mean, men will talk about sex in the locker room. Right. But it won't be too clinical. It'll all be tilted toward probably something better than reality. So erectile dysfunction is a broad term that we give to challenges or difficulty achieving and maintaining an erection. And there are two big components of it. And I think this will probably ring a bell for most of your listeners. On the one hand, there is what we call libido, or an interest in sex, a drive, an excitement, an anticipation of sex. And on the other is the actual mechanics of it. Getting hard, getting in, getting off, we say. That's another set of physiologic processes. Either one of those can, or both, can go awry. So when we talk about libido, or excitement about sex, that is substantially managed in the brain and driven off of hormonal production. Hormones are made largely in the brain for libido, for excitement, and to a lesser extent in the sexual organs. I think all of us were trained by advertising, by Madison Avenue, that testosterone does everything. But as it turns out, it doesn't. It's certainly an important hormone, but it has a limited impact. In fact, its greatest impact is on helping men be interested.
Okay, so that's where the interest really comes from the testosterone,
Right.
not the actual physical
Right.
boner.
Well, it's funny because there are some interplays between those two. That is, when you get hard, even if you're made to get hard through no fault of your own, because there are medicines now that can make someone hard, even if they're in a coma. And when you get a boner, your brain senses that tremendous pressure and tension in your penis. And so your brain, through evolutionary bells and whistles, has decreed that it's time. It's time to have sex.
Okay.
And so when you're hard, there is a drive, there is an excitement, and it almost feeds itself. But testosterone is a very important part of the initiation of it.
Okay. Yes, I think that's what happened with my case, because I got tested initially many years ago, and my testosterone was actually very low. And the doctor at the time put me on the gel, which it didn't really work for me. And then when I met you and you put me on testosterone, it really helped me with the, like you said, with feeling horny or wanting to have sex. It really made a big difference. Like, I'm really grateful for having that treatment, the testosterone treatment. But I had lost all of that. I had lost the interest in having sex. I couldn't even get a hard on. So it was all these things that were going on with me, and so is there a way to differentiate between psychological versus medical? Like, how do we know? How do we test which one is it, and how do we?
I'm glad you raised that because all through training, I heard that same sort of dichotomy, and it would either be this is all in his head, or there's really something wrong. And I wonder, why, if something's going on in your head, is that not regarded as something's wrong? I think we spend too much time trying to downplay the role of emotions and the power of the brain in making things happen. And it's a mistake, because the truth is, the treatment is substantially the same if it is problematic enough. Of course, we want to treat anxiety, but some cases of anxiety are really profound. And if someone is so anxious about the prospect of having sex that they can't have it without some sort of physiological or pharmaceutical support, I'd be, I can't say a bad word. I would be a bad person if I said, oh, no, I'm not going to give you any medication at all, something that I know would work, because I think this is in your head.
In your head.
And you have to get it out of your head. No. It's like saying you have to get your blood pressure out of your heart and blood vessels. No, you treat it with medication.
Right.
It's, and I think that's one of the reasons why we're almost trained not to talk about this stuff. Because if you
because
say,
they think it's a mental thing.
There's such a stigma for having anything related to mental health, but it's an organ just like any other organ. Your brain is a very powerful sex organ, and if it's not functioning normally, the sex isn't as good as it can be.
So Dr. Keys, what would you tell someone that has been told by other physicians that it's a mental thing, for this man or this person to seek treatment instead of just keep thinking that it's a mental thing? What would you recommend to them?
Well, what I would tell them is that's really encouraging news, because there are so many things that are now available to help us overcome some of the challenges we have that are caused by our brain. Anxiety, nervousness, difficulty thinking, fears, irrational fears. Many things are treatable or amenable to therapies, various therapies. And so what we find is there are many young men for whom their mechanics, their plumbing, their physical selves are very robust. But the problem is the expectations of their performance are so high. So many of us are watching porn at a young age and have some crazy notion that, oh, that's how I'm supposed to look when I'm having sex.
Right,
There's
right.
nothing like what sex is actually like. And if you've ever been at a porn shoot, it's like a minute and a half of something that looks exciting, and then about an hour of setting up and getting everything ready. So it's not really anything like what you see.
Right, right. That's a good point.
And yet, many young men are thinking, oh my God, I don't look anything like that. I can't perform like that. I can't stay hard for, a 2-hour movie. I can't.
So a lot of times the media also.
Oh, absolutely. I can't penetrate 9 people, and they're not expected to penetrate 9 people, but they're so anxious about how far a gap there is between what they see in porn and in the media and where they believe they are right now. I'll often have someone come in saying, I'm fine on my own, I'm perfectly fine, I have no trouble at all. The instant I have to get into some sort of social situation with even one other person, that's it. I just know I can't live up to it.
Right, right.
And now when they hear, oh, there's absolutely treatment for this, and it's the treatment that we'll do.
Okay.
Everyone knows about the pills, and the pills are great, but what the pills do, Viagra, Cialis, Levitra, they're really good at slowing down the metabolism of the hormones we make.
Of the testosterone?
Actually, of the prostaglandins that make us hard.
Oh, okay.
So it's not so much about being interested in sex. I think we can get there, but it is the actual performance. And so what happens is, if you take the pills, you do okay as long as you're making a lot of that hormone. But you can imagine what happens if you get very nervous. Adrenaline is the best boner killer of all.
So can I take some Xanax before my next encounter?
Well, actually, what happens is you'll try something right now, and I suspect that you will think, oh my God, well now there's nothing to be nervous about.
Okay. Yes, because I do get nervous because like I mentioned before, it's hard for me to stay erect. I get to that point, and then sometimes it's hard to maintain that.
You get into your head.
In my head. Yeah. Sometimes it's easy. Some guys take 10, 15 minutes and they're done. So that's good for me. But some guys take longer, and then I'm like, oh my God. And that's when I start panicking.
Right. Yes.
So,
because you've placed this huge expectation on yourself. I should be able to serve this whole range of needs that other people have, and we can't. It's perfectly normal not to be able to.
Okay, so I have 2 questions about testosterone. Why is testosterone so controversial? Before I saw you, I saw other doctors, which was clear that my testosterone was low, and they did not want to put me on testosterone, except for the first doctor. Then the other ones that I talked about, again, they didn't want to talk about it. They said that all kinds of bad things that were going to happen to my body. And so I'm like, why do you think it's so controversial? And then the other thing is that, how do you compare medicine to when you go to GNC or one of those Whole Foods stores where they have a row of these vitamins and minerals that promise to give you to work as testosterone or maintain your libido and maintain your sexual drive? Do you recommend those or over something more medically like testosterone or the other medicine that you may recommend?
Well, so for the first question, why is testosterone treatment so controversial? And I think it's controversial because it is regarded as a drug of potential abuse.
Oh.
And probably back 50, 60, 70 years ago, when testosterone was first being produced artificially, it became clear that it could create certain kinds of effects but we didn't know all of the effects. And so many people in the clinical community got nervous, and they're saying, we know testosterone affects the muscles and it makes them look bigger and better. That's true. But we also know it affects the bone marrow. We know it affects the bones. We know it affects the prostate. We know it affects the brain, and on and on and on. And what makes anybody nervous is, okay, he's using it now. He may not have a problem tomorrow, but what are the long-term effects? I think at that point in our history, we had had a number of examples of things that seemed perfectly innocuous, and then 20 years later, people are getting the horrible lung cancer from asbestos. Asbestos seemed like a miracle fiber because it was so fire retardant, fire resistant. Well, it also causes lung cancer. And so that's an example of why we get skittish about, like, let's not all say it's perfectly fine. What the controversy comes, though, when there are differences of opinion about how long do you have to wait, how hard do we have to wring our hands before we say, well, these are adults, and we're going to be with them as they enter into this treatment, and we're going to monitor carefully. We're not just going to give them 6 years of treatment to take off on their own and wish them a happy day. We're going to spend time with them, and just as we've been doing, monitoring the numbers and making sure we don't have to tweak it, and we did in our case. I think that is what's different than, or from what its use originally seemed to be. There was a lot of people in great big guys in gyms.
And based on your experience, is there any research out there on testosterone?
Oh, there's a great deal of research. And that's what's helped, I think, a lot of clinicians begin to assess those risks and share those risks with their patients so that they together can make some decisions about, here's where we want to place our bets. Here, we'll take a small risk here, and we'll keep, we'll watch it carefully. And if we see any indications that that risk is coming to fruition, then we'll tamp it down.
Okay. And what about like the things that you see over the counter that allegedly help with?
Well, one of the things that's challenging, and many of them may actually be of some use, but what's really challenging is that the bar isn't as high as it is for a pharmaceutical agent that has to go through years and years of testing for both safety and efficacy. Some of these things that are supplements are regarded as foods, and so it's not regulated much more than making a twist ice cream cone. And
so they're not even FDA approved?
Oh, no.
Okay.
They're
so I can just create a product and say, this will give you the best boner in town.
You can say that, and you actually would be able to get away with something like that because it is food. You believe it is the best. It will give you the best boner in town. It's your belief.
Right.
You have your First Amendment rights.
So the bottom line, I think, is that if you're dealing with erectile dysfunction or have problems down there, I think the best bet is just to see medical care instead of going and buying these things, or even in the black market at the gym or anything.
I think the biggest mistake is to assume there's nothing that can be done.
Right. Okay.
The very first guy I treated with the injections was certain there was nothing that could be done, and he was really reluctant. And I said, well, let's convince us both that there's nothing we can do. And that way we can forget about this and never do it again. And he said, all right. And so I treated him, and he called me from the cab that he took on his way home. And he was crying, and he said, I never thought this would happen to me. I am a different person at this moment. You've opened up a whole new trajectory in my life. And then he said, I thought I was going to have to spend the rest of my life not dating, but having dinners
Oh.
Like I would never have sex
Not being
again.
intimate.
Not really, yes. And it was so powerful to hear that.
That is powerful.
It was very moving to think that something so important was being so minimized.
Right.
Largely to protect other people from their feelings of embarrassment talking about sex. And so that's why I would say I'd encourage everybody, get it checked out.
Okay.
It's like asking for anything. The worst that can happen is they say no.
Well, now you know Dr. Craig Keys. He will definitely meet with you and talk to you about it. But I also want to quickly mention also, after we started my testosterone treatment, it also, like your other patient, it just changed my life completely.
Yes, I remember.
I was tired. I was moody. I have no sex drive. But when I started the testosterone treatment, it just changed my whole life in general. Like I'm happier. I feel energetic. I'm 52. I feel more vibrant than I did when I was 20. So for me, it's worked a lot. And I'm really happy about the treatment.
You are a new man.
Exactly, you are, because you just changed entirely. So now I'm curious about the next shot that you keep talking about, the next injection.
Sure. I think, well, you had mentioned that you've tried the pills and they just really don't do
The pills don't work for me. I get headaches, I get flushed, my blood pressure goes up. I already have blood pressure problems. So I don't want to do anything that's going to get into my system and stimulate and trigger my blood pressure problems. So what would be my next option?
There is another treatment that was developed because we began to create erectile dysfunction by the surgery and radiation and treatment we were doing for prostate cancer.
Oh, okay.
About 50 years ago, we invented a test to rapidly screen and diagnose people for prostate cancer. And we discovered all these men who had it, and then we treated them all. And that treatment ended up causing them to lose their ability to stay hard or really impair it. And so we studied what is it that makes somebody hard, and what is it about that surgery that ruins it. And we found out that fooling around with the nerves and tiny blood vessels down in that area is really a bad idea, largely because that's the spot where special hormones are made that only belong in one part of the penis. Here's a little cross section.
Okay.
It all happens by some hormones. Hormones are essentially proteins that tell other things what to do.
Okay.
It's a great job. It's
Just
bossing
boss
people around. So these hormones are ones that we can actually deliver directly to that spot. But we have to get them into these chambers that get hard.
Okay.
And so we use a needle. And the needle is
a needle?
Yes, a needle.
Oh my God.
And you know what? A lot of men are really surprised to hear that because the needle goes into the shaft of your penis on the side.
Okay.
And there are fewer nerve fibers there than there are on the skin of your elbow or the skin of your earlobe. This is like having a hair plucked.
Okay. You promise?
Well, we'll see.
I'm very good with pain.
We'll turn up the sound.
Okay.
And then we'll just let your studio audience rate you on your screen.
Okay. No, I'm very good with pain. So this injection, what's in the medicine? What's in the
The medicine is made up of primarily this hormone.
Oh, okay.
And some other compounds that support the blood vessels in their expansion.
I get it. Now, this injection, you do it right before you get intimate with someone? Or how long should I do it before?
Maybe 10 minutes. So it's pretty much.
Okay. And how long will I stay erect?
Well, one of the reasons it's such a popular treatment is that you can dial it up or dial it back.
Oh, so you can kind of time it.
Time it for...
Okay, for the 5-minute guy versus an hour guy.
That's right.
Okay, so this is not going to hurt? Just a little bit? I'm really good with pain.
This is not going to hurt anywhere near as much as, say, the easiest facial.
Okay, so this is only as you're going to need it. I can't just do it on a everyday thing.
No, this is something that we call on demand.
On demand.
So when you want to be hard,
okay,
you do this shot.
Okay. And what is this called and how much does it cost? I want it now.
It's
I want to order
called
right now.
sort of the generic term for the whole family of treatments is called Trimix.
Trimix. So there's
It's
three.
called Trimix because there are 3 ingredients.
I see. Okay.
But some others are just 2 ingredients, and
Okay.
some of the stronger ones are 4 ingredients.
Okay. Are there any side effects with this? Like, can I?
One of the wonderful things about this is that it's the very same hormone, the prostaglandin, that you and I make
Okay.
to get hard and stay hard. That's why this was what was created, because it was really tough to get a man to make that hormone when we cut up the nerves and blood vessels from the surgery for prostate.
Okay, here we go. Oh, that wasn't bad. That's it?
That's it. Are you still alive?
I'm still alive. I think I'm still breathing. I'm actually feeling hard now.
See, I was going to say.
I'm not nervous anymore. I'm now that the needle's gone.
I can see the bone. You'll make friends anyway on your way back to the office.
So, guys, now you guys know Dr. Craig Keys. Now, you have different offices, right? You work in California?
Right. We have an office in Palm Springs, in Fort Lauderdale, here in New York.
Okay, that's perfect. So if you're not in New York City, you can go to, if you're near California, Palm Springs, or Florida, you can still have access to Dr. Keys and his knowledge and his needles. It didn't hurt. It didn't hurt at all. So that's it. Thanks again for watching. And again, don't forget to subscribe. I just showed you my manhood. Now I deserve a subscription. Thanks again for watching. See you guys next time.